I'm Dr. Elaine, and we're going to be talking about poop today. Your poop is very important, and it's actually good for you to look at your poop before you flush it. Your bowel movements are something that you should have daily, and at best, you should have a bowel movement 3 times a day. And if you don't, we can get you there. But why it's important is because that's the number one way you detoxify. So all of your waste, that's how it goes through your body. It's not just food waste, right? It's how your hormones get metabolized and get out of your body. It's how other toxins get out of your body. Your microbiome is actually a very important piece of that. And you actually have more bacterial cells that make up your body than you do human cells. It's kind of insane. It's like, are we made for the bacteria? Hard to tell. So you can have what's called gut dysbiosis, where you have an overgrowth of bad bacteria that can cause disruption in the lining and cause inflammation, especially with lipopolysaccharides. That imbalance can cause GI issues. So if you're having symptoms like constipation or diarrhea, or bloating or heartburn, all of that's related to your gut. Actually, even fatigue is related to your gut, autoimmune conditions, joint issues, skin issues. So a lot of things stem from your gut. And so that's why it's also really important to talk about your poop. What's a normal poop look like? So we're gonna pull up the Bristol stool chart, and it's got some ratings on it, anywhere from a type 1 to a type 7. And so you wanna be at a type 3 or a 4. And what that looks like is a normal brown, dark brown, no blood in it. If it has a tiny trace of bright red blood, that's okay. Sometimes that can be due to hemorrhoids. No mucus in the stool, and no undigested foods except for corn. We can't digest corn. So you shouldn't be seeing any leafy greens in your stool. That's indicating that you're not digesting your food properly. And we can go into that a lot more, but your stool should also be shaped in like a snake. It kind of sounds weird, but it should be nice and well formed. It shouldn't be shredded or loose, and it also shouldn't be little teeny tiny balls. And to get it to that shape, your microbiome plays a big part of that, but also your diet, which feeds the probiotics, the good bacteria in your gut. Exercise, if you're getting enough nutrients, magnesium is really good. Magnesium citrate is probably the biggest one for constipation. I was mentioning that your microbiome plays a big part in what your poop looks like, so it's important to feed your microbiome the right foods. So you always start with diet. So make sure you're getting enough fiber. 30 to 40 grams per day of fiber is the best for most people. Although if you have SIBO, which is small intestinal bacterial overgrowth, they don't usually respond well to fiber. And we can go into that further, but not right now. So fiber can help. Enough water. Hydration is another big factor in regular bowel movements. Stress, that is another big one. So, if you're, overly sympathetic, which is your fight or flight, then you're not going to be in a relaxed state to use the bathroom. So exercise will help you to have daily bowel movements. It'll help things move. When I was talking about dysbiosis, we want to kill off that bad bacteria. I usually use herbs to kill the bacteria. There's other things that grow, not just bacteria, but there's yeast like candida, viruses, or even parasites. So those all need different types of antimicrobial herbs or medications if you prefer. So killing off the overgrowth and then supporting the good bacteria. So repopulating the bacteria in there. I like a spore-based probiotic. because it goes in, stays in your gut where it needs to be, and then it actually kind of tells your other good bacteria to grow. There are a lot of bowel movers out there. Just be careful that you aren't using them too often to create that like laxative effect, because you can be dependent on it. If you are having any of those symptoms that I talk about, so bloating, constipation, diarrhea, even the fatigue or the joint pain or skin issues, I would look at your stool. Well, not I, but it's a functional stool test, and what it looks at is your microbiome. So the good bacteria, the bacteria that's overgrowing, the bad bacteria, the viruses, parasites, yeast, and candida. So it looks at all of that, and it looks at your intestinal health. So do you have inflammation in your gut? Do you have enough digestive enzymes to break down your food? Do you have blood in your stool, microscopic blood that you aren't aware of? Do you have leaky gut? So intestinal permeability. So leaky gut's like a big buzzword. And so what that really means is so your lining, your gut lining is supposed to be a barrier, right? So you want those cells to be tightly joined together. And so leaky gut can happen if you have that microbiome imbalance. So that lipopolysaccharides can cause inflammation in the gut and can cause the cells to be less tight. And so that stress can cause leaky gut, processed foods, gluten, a lot of medications. So NSAIDs, so those are like ibuprofen, aspirin, some other things too. But it's a lot of stuff that can cause leaky gut. When you have leaky gut, things can pass through. And so your immune system will see that and say like, hey, I don't recognize that guy, and will increase antibodies against things like food. So if you have a lot of food sensitivities too, you might want to look at if you have leaky gut first before you even do a food sensitivity test. And we have a lot of remedies for it, both natural options and with peptides. BPC 157 taken orally is key for that. There's actually a great supplement from Integrative Peptides called Gut Feeling, and it's got BPC 157, the healing peptide in it. It's got KPV, which is good for inflammation, and if you have like any mold or histamine, reduces that. It's also got some immunoglobulins, which are great because a lot of your immune system is in your gut too. So we want to support that. So Akkermansia is like a keystone species in the gut. So you really want that one to be supported, and you want to have more of that to support the other bacteria. Thanks for watching. Now go forth and drop some knowledge, at least 3 times a day.